Female sexual dysfunction is a topic that is not often talked about, but should be addressed because it is important. Here to explain, we have Dr. Christi Pramudji with Cliovana. Doctor, thank you so much for being here. And let's just be a couple of girls having a chat in the living room.
Yes.
A lot of people don't want to talk about sexual dysfunction. And typically when we do, this is on the male side when we're having this conversation, but women have their own issues.
Absolutely, yes, it is. You're absolutely right. It is so focused on the men, and part of my mission is to get the word out about what we can do to help women to enjoy sex and have more sexual pleasure.
And let's talk about sexual wellness. Why women should be thinking about it, should be talking about it. We should discuss this with our girlfriends and doctors.
Yeah, sexual wellness is actually a really important part of our health. It's going to benefit our relationships and also just our overall health. It helps to decrease blood pressure, improve our overall well-being, our libido improves, psychologically we feel better and we sleep better.
This statistic is really interesting. In a recent study, 60% of women answered they were not satisfied with their sex lives.
That's
and
correct.
That's how they're going through life.
Yes, that is correct.
And you're saying that doesn't have to be the case.
It should not be the case. That is not the way. We were designed with an organ that has 8 times more sensory nerves than the penis. The clitoris, which a lot of people feel kind of weird saying that word, but it's part of our anatomy. We should be familiar with it. It's part of the vulva, and it's made for pleasure. So we need to tap into that, and we should be able to take advantage of that and talk about it and get treatment for it.
And we're going to talk about Cliovana, which is an actual treatment, but let's talk about who would be a candidate for this.
Really, anybody is a candidate for it. It does seem to be that as we get older, that we start to lose some of the sensation, some of the blood flow to the area. It becomes more difficult to have an orgasm as our hormones change and as we age. So most of the patients are going to be 40 and up, but even some young women can benefit from Cliovana.
Okay, so you're saying, and just like, that statistic was saying, a lot of people aren't satisfied with that, so don't go through life. There's some help here. Okay, so let's talk about what is Cliovana. What exactly is this? Is it a treatment? What is it?
So it's a treatment. It's non-invasive, so there's nothing going in the body. It's all going to be on the external area. It takes about 10 minutes. It doesn't hurt, and you do a series of 4 treatments over 2 weeks.
Okay.
And so it's sound waves that are going in to the clitoris and bringing in more blood flow and more nerve endings so that the clitoris is more responsive, so it's easier to have orgasms and there can be more common.
Talk to me about the sound waves. This sounds very interesting to me, and it's happening on just the exterior of the body. So the sound waves, how is that helping? So
the sound waves go in and they do sort of stimulate the blood vessels and the nerves to promote more blood vessels, more nerves. That leads to more lubrication and more responsiveness.
Okay. And so how is Cliovana different then from other treatments? Because I'm sure there are lots of other things out there as well.
Oh, the thing about Cliovana is that it's just completely non-invasive. So it's a lot less intimidating than some of the other treatments that do involve needles or probes that are going in. It's just a very easy treatment to go through.
And you said it's only, you said 4
treatments.
4 treatments at about 10 minutes per time.
Correct. And most patients will start to see some benefit right away, and then it'll just continue to improve over the next 3 months as the body is doing what it naturally does to build up.
And kind of regenerate sort of that loss of what you're experiencing.
Yes.
So would this be just 4 treatments over a lifetime, or would we have to maybe have some maintenance? So
usually there's going to be maintenance. So most women are going to need to do a touch-up of 2 treatments each year after that.
Okay. And what else do we need to know about the treatment? Is there any downtime or side effects or anything like that? That's
another great thing about this treatment is there is no downtime. You can have intercourse that night, and a lot of women actually have enhancement that very night.
So they're seeing results immediately?
Yes.
If you can.
Yes.
I want to chat about you, first of all, because you are Houston's only female urologist who only sees female patients, which I think is really important because sometimes we don't feel comfortable talking to other people about the issues that we're having. And so your background is all about that.
That's what I do. And I've only seen women for several years now. I started out in urology seeing men and women, and then just narrowed it down to only women. So I'm focused on our issues. And I put myself in that group. I mean, I'm a postmenopausal woman, so I'm dealing with all the same things. So focusing on bladder lifts and sexual health, even kidney stones and, leakage problems.
Right.
So all kinds of things like that. Surgery and lots of non-surgical treatments that are just incredible that we have.
Well, Dr. Christi Pramudji, thanks so much for being here. I appreciate the conversation.
All right, thank you.
Cliovana has a special offer for our viewers. Get 20% off the treatment now through March 17th, but you must mention Houston Life. To get in on the special offer, you can call 281-542-8124. And for more information, visit cliovana.com. Stay with us. We'll be right back.